completely about storytelling. I'm sure many of you are contributing directly or indirectly to the Indian society, and being doctors, we do it day in and day out, and it makes enormous difference when you give in a different way. And my story may not be completely different from your story, but to a certain extent, things as you grow older, how you can do differently, I might show in this talk. And it is always Raja's idea that every conference, he wants to have some of the things which is done completely different way than only to being a surgeons or a spine surgeons or neurosurgeons. So first, I just want to ask questions to all of you. What made you to choose this profession of medicine? Please raise your hand. I will tell you. Service. How many of you chose, go back to your MBBS days and think that how many of you chose medicine as a service, that's why you wanted to enter this medical field? Please raise your hands. There is only about 30%, very good. Please raise your hands thinking that it gives a great social standing to you. So this is a bigger number. And please let me know how many of you thought that this gives a great economic liberty. There is 40% of you, 20%. So how many of you thought all three things will come? Oh, there are still doubters. I can understand that. Yeah, so to be frank with you, to give this talk, I have a some background to myself. I did enter the medical school way back in 1984. It's a long ago. And when I was born in 1967, when I was born in 1967 till 1975, India was in a great turmoil with two wars, one with Pakistan and one in China. And the economic situation of the country was so bad, I distinctly remember in my 5th standard, to get a half liter of milk, I had to stand at 5 a.m. in a queue because the government has a provision that every household in my town will get only half liter of milk. And that is the era I was born. And till 1972, all of us used to have a smallpox vaccine because it was still having great mortality. So I was the 8th son to my parents, and you can understand, in that era, what will be the problems. So in that era, economics was bad, and nobody has conclusion what you will have in your future. And the future was bleak compared to the present day India. So from that day till today, when I crossed my 50, I had some kind of awakening to think, did I dream what I have today? Today, I'm in a fantastic field. Luckily, my surgical skill is reasonably good enough to treat many patients. My mortality and morbidity are significantly lesser, and I have what I aspire to be human being. I have everything from the best house to the wonderful family to the best car I drive, and I dress very well. Did I deserve this was the thing. Is it a human life? I was always thinking once I crossed at the age of 50. So, then I was, and my another ambition was to enter the medicine. My goal was to become a GP, a general practitioner, because in a childhood, I had seen one GP who was very famous in my town, and everybody used to go to him. My dream at 5th standard was to become a GP, serve in a small local place so that everybody will know who I am, and they will feed me with whatever they get out of it. So service was my motto. But beyond service, I got everything in my life. So then, I started thinking, am I happy? What is happiness? If you look at the dictionary, the happiness is defined as feeling and showing of the pleasure or contentment. Satisfied with the quality of the standard what we get, willing to do something different, and fortunate and convenient. Believe me, it's this definition, I'm extremely happy. Happiness is not the goal. Happiness is out of what you do, and you have to feel happiness to yourself because happiness doesn't come with somebody else. So then I look at, did I psychologically a great well-being? A psychological well-being is the one who has the great optimism, and a sense of purpose strikes you with accomplish you do. So definitely by the age of 50, 52, I started thinking that, yes, I have everything. I had to do something different than what I'm already doing. Yes, I was helping people. I worked in a different hospital, from charity hospital to the public service to the private hospital, and I was having something different, which I was always satisfied with my work, but I thought I'm doing at the individual level. I had to do much bigger one, which will be much more impactful to the many people rather than as a neurosurgeon doing for one patient a day. So I was started thinking, and one patient came to me at the age of 90 when I was in Satish Rudrappa Hospital, a very bubbly, chirpy human being, very talkative, and he had such a glow in his face. I was doing, once again, the laminoplasty to him because of myelopathy, and he has sent all his children to US and UK. He was living alone, and he was ready for surgery, and all the children came in, but he was never wanted to be dependent on them. Then I asked him post-operatively on the third day, how come you're so active, so bubbly? He told me gleefully, saying that, Dr. Satish, you want to be happy in life, is the three things I will tell you, never forget. I have not forgotten that a human being yet. He said, give, 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 whatever you have. Never take anything from anybody, never expect from anybody. As a human being, you're born with the ultimate goal of the beautiful brain, which can think better, which can do better, and whatever you think, you can achieve better. So is your surgical field. If you want to be a neurosurgeon and a perfect spine surgeon, you can learn anything as long as you focus on that. In the similar way, this human life is given to give to others rather than to imbibe yourself. And that made me to change from that day to today, and I tell this to every of my fellows and students. So then I was understanding I'm happy. What is the purpose with which I have to live? The purpose is different. The Picasso beautifully has told that the meaning of the life is to find a gift. But the purpose of the life is to donate, give away that gift. That is very, very important. Whether you're surgical skill or you have a money or whatever you want, if you give it, that is the purpose of the life rather than accumulating everything. So with that background, I'm a great believer of what is called in the Japanese system is ikigai. In the ikigai, it mentions completely everything. What you love, you had to do with your passion, mission, in a profession, and occasion. You had to, what you love, you do in all these four. Earn from everything. Do good in everything, and acquire everything, and give it away after you consume whatever required to you. And this ikigai, is the way to lead a life where you can be happy forever, and you can give more, and at the same time, enjoy your day-to-day life with happiness and energy. The energy within you to come every day. Believe me, by the age of, I'm now 57, I have done every surgery from the brain surgery to the coccygeal surgery, and I can do with elan, with the ease in every surgery. There was nothing else for me to do because I started telling everybody, what else complex thing I can do it. So after some time you saturate, but you want something energy as every day to get up to do something different. That energy is nothing but the purpose. If you stop that purpose, your brain degenerates, your dementia starts, and your walking ability comes down. That's the day you'll get to know that, man, as a human being, I had to have some purpose to get up in the morning and do with a great vigor and energy. So in 2007, I started an NGO called Sukriya. In Sanskrit word is Su is good one, Kriya is the work. That is started by two of my friends and myself. Both of them were the highly qualified IT professional CEOs. Three of us were the best friends. We said, let us start giving back whatever the little thing to ourselves. In 2007, we started an organization which is registered so that we can help many more people. And at the same time, we thought we had to enroll a lot more people. That's why we made this cycle, the circle of help, where if we help somebody, he should help somebody else. So in 2007, I started taking every patient who are below poverty line, whichever the patients who come in, irrespective of their background, if they needed a surgery, irrespective of their economics, I started doing surgery. And if they get better, and I used to do only for the patients who can get back to the society. I never did for patients with cancer. I never did for the patients who do not recover. I wanted them to recover, get back to society, and take care of their family and others. That's why we made it a circle of life. And we also thought, few more people wanted to join after listening to us. And then we found out a program called Rotary. We formed a Rotary club called Rotary Bangalore IT Corridor. 7 of us started. And today, 17 years, we are together, 7 of us, and we are doing the wonderful work where most of them participate in whatever the ideas I put in. And I will show you a few examples where how with many more people, with your thought process, you can contribute back to the society. So the best way, I'm a great believer and a follower of Mahatma Gandhi. He said the best way to find yourself is to lose yourself in the service of the others, in whichever the service you do. With a doctor, you keep doing it in a best way, sure, it will give the result to you. So in 2020, I envisioned 3 programs. By then I was 52, 54, and then I took 2 things. One, health and education was the priority. So I started a community project called as Epilepsy Prevention and Integrated Care Program, where we will do a different program to epileptics. I will show you the example of it. I started it, and as of today, we have done a significant amount of the work. And I started looking at the places where I can teach, where there were no neurosurgeons, no spine surgeons. In that way, I produced the first spine surgeon where I communicated myself to the government. I communicated myself to the whole, the things which are required. And I got the student, paid him, trained him, even in the cadaver labs, and sent him back. And he became the first spine surgeon of Bhutan, and he's training few more in that country. And for last 2 years, he has already done closer to about 400 surgeries. And the third one I did, which is much more pleasureful to me, is a high school, which I built to the government as 18,000 square feet high school, which I built for the people who are migrants, who are come from North India, and their parents were working as in the laborers. And those children, these are the children who are already in the primary school. They did not have a government high school. I raised the fund of 5.5 crores in 1 week, and we built this school and handed over to the government. 5 of us did this school. And believe me, these children, the way they speak English, the way they put Shakespearean drama, and they become first in the country for the football team, after studying in this school, which is now in this school. Even the private school students want to enroll in that school, where 3 of my friends teach every day, along with the government teachers, the social science to the moral science to these students. So these 3 projects, I do not go to elaborate it. I will show you one project, that is the epilepsy project, where a single individual I was treating, how we can make it scaling into the higher level. I'm sure many of you who have some of the medical project, you can also envision with me that you can make any small project to the bigger project and how to do it. So this was inaugurated way back in 2020, and epilepsy is a great burden. 2 of my patients, who were one was the age of 21, another was 19. Both came from rural part of Karnataka, in the northern Karnataka, and they were with me for epilepsy for 5 years, but unfortunately they were uneducated and they got married, and they never told the other family that they are epileptic, usual pattern in India because of this social stigma. And both these girls had an epilepsy post-marriage, and other family got into tussle, and they succumbed by committing suicide. They succumbed to their life. So then I thought the stigma in the society for epilepsy should be taken out, and I created this epilepsy program. And the stigma is so much rampant, they cannot afford even a medical bill for their anti-epileptic drugs. So there is a great impact with the epilepsy, social, cultural, schools, and many of these children cannot study further because of the mental retardation. So I did, you see this, there are epilepsy we think is a complete tonic-clonic movement, but they come with a variety. The one of that patient is, I will show you the video, where you keep watching this called video EEG. When we do the video EEG, he'll be sleeping. Suddenly he gets up and looking at in a multiple ways in the thing, because it is a classical, we call it as complex partial seizure. And every night you can see the EEG on the left side, the waves goes completely epileptic, and the patients, couldn't go to school. He was getting from childhood and stopped learning, and he was almost partially required help for all the activities. This is yet another patient. You can clearly see here in this patient. Once again, she will just grope in the air. This is, once again, every epilepsy starts in small part of the brain. If you identify that small part of, where it is coming from, if I surgically remove, they become cured. most of these patients. And the third one, you see this is another girl, got married at the 22. In the middle of the night, in the 6th week of postpartum, she started this. In the middle of the night, she'll get up, she will just tap her tummy and looks all around. Once again, it is a complex partial seizure. So as a good neurosurgeon and a neurologist, if you this is another patient where the facial twitching happens to him and he can't learn anything and talk. So all these patients will have some of the structural problems, and we call them as a drug-resistant epilepsy, where many of them, require more than 2 to 3 medication. They'll be on epilepsy for more than 4 to 5 years, and more than 2 neurologists will see. We call drug-resistant epilepsy. But a good neurologist, if we do the EEG, and if we find out where the focus coming in the MRI and PET scan, if we treat this patient, they become completely curable and their life changes significantly. But unfortunately, it requires a further, the investigation itself costs about 75 to 90,000 rupees. Most of them cannot afford. Then I started doing, with every hospital where I joined, I asked every hospital to give 20 beds free of cost. It is in my contract that they have to give 20 beds free, no surgical charges. I will waive off my charges, and the medicine will be given to them free of cost. Our Rotary will supply the main consumable required for surgery. And from the last 5 years, I have done these patients. We investigate with the free MRI, we investigate with the free PET scan, free EEG, and we have done many surgeries and also started giving talk in multiple places to increase the awareness, to give the low-cost solution. So I started this EPIC program using a CSR fund from one of the corporates, our hospital, whichever the hospital I work, which will give free beds, and we opened a new epilepsy program. So it is very easy to launch this kind of a program for society, but your team has to be encouraged. It is very difficult to sustain. And how to sustain these things is another challenge. As a good doctor, to give back to the society, you'll always have it. So first is, your perseverance, and you have to motivate your own team. I'm lucky, I'm blessed that my team, which is working with me for last 10 to 15 years, everyone knows what all the kind of work we do, and they all cooperate, and they come up with every new things. And I went to the Chief Minister government of Karnataka, started propagating this work, and I went to the Doordarshan to give a 30-minute talk on this, which is available on YouTube, and every AIR, the All India Radio, I visited, gave a speech in multiple places, and as of now, these are the number of hits I got using All India Radio. So almost about closer to 5 million people with epilepsy. What is epilepsy? How it can be treated? I have given a talk in multiple languages, and with that language, with that talk, many patients come to us looking for the treatment in the society as of today. And these surgeries are not cheap surgeries. And an average epilepsy surgery requires about 8 to 10 lakhs, but no hospital can waive off. But if you are a good doctor, you're an ethical doctor, if you are giving back to free surgeries, believe me, even a corporate hospital agree for this kind of a program. And my hospital has agreed. And if you see here, when I'm doing the surgery, a big craniotomy, we use the electrodes. This electrode itself costs about 70,000 to 1 lakh rupee. And each time we have to take it out. And we use every equipment from navigation to everything to do this kind of program. But all these things are done for the less than 2.5 lakhs, which Rotary gives, instead of 8 to 10 lakhs, for these patients. So I'll show you one example, one such patient. This young man brought by his wife that he had a severe epilepsy every day in the night. And he had what is called a cortical dystropia, we call, which will be within the brain. And in the middle of the night, he'll get up, he will have a complete seizure. See, but neurologically, it's completely normal. So this patient, the lesion was next to the motor cortex, going up to the thalamus into the internal capsule. You can clearly see it is up to the internal capsule. He has seen many places, many institutions, they said he will be hemiplegic after the surgery. But I did a functional MRI, video EEG, found out that this cortical ectopia, if I remove, he'll be completely normal. I took him for awake craniotomy. So this is using the navigation. Intraoperative CT we did. And I did, using the ultrasound therapy, ultrasound aspirators, I did a microsurgery to him, which took about 9 hours to me. You can clearly see intraoperative CT. There is a calcification within the thalamic region. and then we did a small craniotomy to him. So depth electrode we put in, I identified where the electrical waves are coming. That is the electrical top line is that, where the epilepsy was coming. Used an ultrasound to mark that area. You can see there, that is whatever the upper lesion you are seeing, that is the area which was coming. Then I did the microsurgery to him. So we took out all the things using the ultrasonic aspirator, and at the end, see, completely that lesion was removed. So if you see him in between, he is completely talking. I kept him awake. So you can see him moving his hand. It is an awake surgery. Moving his leg because I had to monitor every part of this. He wanted no deficit at all. He just then he had passed his engineering. His dream was to become a software engineer. So once we removed, the next day, he walked. He did fantastic. Now he's married and having 2 children. So in that way, it makes enormous difference. Yet another patient I'll show you. Last 2 patients. This is a patient who had a cortical dysplasia. Once again, you can see a birth asphyxia related problem. And patient had a right hemiparesis, and in the school, his school performance is coming down significantly. And this patient, we had to do what is called as disconnection surgery, where I'll disconnect his frontal lobe, temporal lobe from the parietal lobe, so that propagation of the epilepsy will not happen to the opposite brain. So I did this surgery to him. This is how the post-operative scan, you can see temporal lobe, and the parietal lobe, up to the motor cortex, I released him. And this is his video post-surgery after 2 months. So he had a moderate weakness, but which improved. And now, he's walking, he's within 4 years. He is now 11th standard, his growth pattern improved. His seizures completely stopped, and it made enormous difference to human life. So in that way, I have done so many of these patients with, purely involvement of our hospital, involvement of my Rotary Club, but CSR fund, we can treat all these patients free of cost. Totally about 90 patients I have done. You can see there, number of radio talks we are given, free EEGs, free video EEGs, free MRI and PET scan is done by our hospital. You think that corporate hospitals are always look for money, but when you have a great project, that will also give the greater mileage for them. And they think in a multiple different ways if you are remaining as a humble, good doctor who can serve the society. So I do every month a camp in the rural areas. I train next generation in the cadaver lab how to do these epilepsy surgeries. And now next 2 weeks, we are opening a new mobile van where this mobile van will go to every village, do the video EEG in PHCs, and any intractable epilepsy with below poverty line will be enrolled in my program. And our aim is to do 1,000 surgeries in next 10 years and propagate it to many more centers who will propagate the same thing. So ultimately, to do this kind of work, you have to have a self-realization. To do the public work and giving back to society, you have to be self-satisfied. For self-satisfaction, 3 things should be important. Your knowledge has to be ultimate. Your day-to-day work has to give the great result, and your family has to be extremely good, and your workplace has to be always with the satisfaction. And if that satisfaction is there, you can do anything which will give the self-motivation to you, and definitely it will make you to serve above yourself to do many more work. And this has been taught by me. None other than my mentor is my mother, who taught this principle to me when I was in the 5th standard, saying that you are born for somebody, not for yourself. Do everything for yourself. Once you think it is enough for you, start giving everything what you have. I think with that, it makes enormous difference in a human life. And if you want to make a change in the society, we have to change ourselves. That's what Mahatma Gandhi said. I think every one of you are capable. When I'm a little person coming from a small town, I always say I'm a child of chance. Many of you are child of choice nowadays because everybody will have 2 children. We are of chance. We were many, we used to have it. I'm sure when I can do, many of you can do it. Thank you very much.
Thank you, Satish. I don't think there should be any questions on this. Anyway, thank you for your commitment to the society and for what you have been giving.
Thank you.
Thank you.
Thank you.
We'll stop at this juncture. Information is that there is a bus which will take you to hotel residency, or you can come on your own. For the faculty, there are cars arranged which will take you there. Around 7 o'clock, you can be there. That's number one. Number two, tomorrow morning there is a workshop around 7:30. Those who are interested, please come. The live session starts at 8:30. The first two cases in the morning is one is C1, C2 fusion, other is a endoscopic laminophoronatomy. Other part of the sessions remains the same.